It is my immense pleasure to introduce our first speaker, my dear friend. It's been many years, Manas, to talk about CTOs, or chronic total occlusions, and how to develop a successful program, because there is no one in my mind who knows better how to develop a program than my dear friend, Dr. Brilakis. Take it away.
Thank you, Subhash. Thank you all again for being here this morning. I want to also start by thanking also Gaffney Events, who's organizing the meeting today. It's the fourth meeting, and we've been very honored to work with him and very privileged. So, starting right off, we're going to start about how to develop a CTO program. These are my disclosures. So, why do we want to start a CTO program? The immediate goal is to get the artery open. So you see a closed artery on the left and an open artery on the right. But why do we want to do that? Why do we want to get the CTOs open? And one of the main reasons we do it, the principal reason, is this one. For the last 3 years, before I got what was happening to me, because I knew that I had heart problems, and I knew that I had bypass surgery, and I knew I had stents in my heart. So I just didn't know what the results from that would be. That procedure was, to me, a lifesaver. Before I had the procedure, well, I was in about my 8th year of having the bypass. My 8th year, I couldn't even put out the trash. I couldn't take a real good walk without taking a glycerin pill. But like I said, after having this last procedure that you guys gave me, I put out the trash, cut the yard, and relax. And take it easy without really worrying about anything so forth. And like I said, I do appreciate that procedure. That was one thing that I did in my life that I think helped me out a whole lot. And it still helps me out. This was Mr. Davis, Vietnam veteran, who has been for 3 years treated with medical therapy and having severe debilitating angina. And after getting CTO intervention, as you heard, he's able to resume his daily activities and feel much, much better. But not only does the patient get better, but the operator gets better. This is an example of a case where you run into trouble in the room, and by having the skills you acquire through CTO interventions, you can bail yourself out and have a successful final outcome. This is interventional cardiology today. You may know about the elephant who, as a baby, came to a circus. They tied him up, and he couldn't move, so he learned he cannot move. Then he grew up, and now he's a huge elephant, but still he doesn't move. He doesn't try to move because he still believes he cannot move anymore. And this is what interventional cardiology is. We're no longer in the grunging era, where you just put a balloon and a stent in type A lesions. Now we can do many, many things, but many of us don't know it and don't believe in it, and we don't do it. And CTO intervention, I guess, is a great way to get introduced to what interventional cardiology can really do today in 2015. And this is an example. This is 6 centers in the United States showing that for CTO intervention, success is more than 90% with complications less than 2%. So you can clearly get excellent results if you are committed to this and you take the time it takes to learn. How can you do this? Starting with the operator. This is from TED Talks, a website I highly recommend. There are 8 steps if you want to succeed. And the first one is passion. So before you do this, you must love what you do. If you love what you do, you're going to achieve it. So this CTO is one of those things. If you don't want to do it, if you don't feel passionate about getting it done, it's not going to happen. But passion is not enough. Hard work is also needed. 10,000-hour rule, Malcolm Gladwell's book. You need to work hard on it, and if you do, success is going to come. How do you do that? You start by studying, open the book. There's a manual that we published, which obviously we're biased about, but can give you the basics. There is a ctofundamentals.org. So many websites, books are available to help you learn. And start always with the basics. The important thing is not the complex procedures. Knowing the basics is what's going to give you the highest success. We now do have algorithms to guide you in selecting the best approach, such as the hybrid algorithm, which is now used for training and for cases in US and across the world. And this is an example of the live courses, which many of you may have been already, which is a great way to learn. This is from 4 years ago. It was the inaugural CTO training course that made possible what many of us can do today. You see many of the key people in the CTO intervention being in that room. And also, proctoring is very important. Having someone in the lab, many of us go and help other people in the cath lab do cases, that helps bridge you, make you feel more confident and get the procedures done in a more aggressive and way. And finally, there are also many webcasts. One is upcoming webcast next week, actually, which will discuss cases and give advice to people about how to get CTO interventions done. It is important to focus. If you try to do everything, it's not going to happen. Doing CTOs, congenital, peripheral, structural is not going to happen. You have to focus on one thing, and if you start a CTO program, it's very important to start doing that thing. And the reason for that is that the more you do, the better you get. This is from NCDR coming out probably this month in Zach Interventions. The more volume you do, the more success you get, and the less complications you get. It's very simple. The more you do, the better you get. How about the cath lab? Cath lab is integral to success of this. You know, our cath lab, Tom Haig and the whole team have been the main reason to be successful doing this. Not only getting us equipment, which can be challenging, as you know, in our system, but also organizing it, having it available at the right time, being very careful to radiation exposure, and trying to minimize that so we don't get radiation burns, and having dedicated CTO days where one can take the time it takes. It can take half an hour or 5 hours, and it's important to know you have the luxury or the option to spend the time you need to be successful for those sometimes complex cases. How do you convince your administration about this? Well, administration cares about the bottom line, and yes, it's true that CTO interventions do cost more. You use more wires, you use more balloons, you use more stents. However, this is from Piedmont, and actually the contribution margin, which is the bottom line for the hospital, was the same for CTO and for non-CTO interventions. Also, there is the so-called halo effect, which means that if you think someone is good in doing thing A, then that translates to everything they do. If you have a positive opinion about someone, you think he's good in everything. And the opposite is true. If you think someone is bad in one thing, you think he's bad in everything. Clearly, there's something to it that is not right, but the reality is, if people perceive you as being good at one thing, such as CTO interventions, then the reputation of the institution grows beyond that field. And finally, it's critically important to educate and engage the referring physicians so that they know what can and cannot be done, sharing your cases, calling them back, discussing what happened to those patients. So CTO intervention is a journey. This is not a destination. Konstantin Kavafis is a Greek poet who said that when you start on the way to Ithaca, wish that the way belong, full of adventure and full of knowledge. In a way, CTO intervention, at least for me, has been this quest. Started 7 years ago with a retrograde case. Don can attest to this. It was a very challenging, complex case, but it has been an amazing journey. Helped me personally grow a lot. I think helped the cath lab get more confidence and be able to treat much more complex cases. And I think, at the end of the day, it did help the patients. That is the most important thing from what we do. I'm going to stop here, and thank you all for coming today, and wish you a great night.